This session covers the history of the pharmacist education, the requirements and competitiveness of pharmacy school, the general job outlook and breakdown and where pharmacists work, and finally, the role of the ambulatory care pharmacist. Now that we've heard from Paulius about the issues facing primary care recently or for a very long time, I want to go more into pharmacy and how pharmacists can support that. And before we get to that extra fun part, I want to give some more history on how pharmacists got to where they are now as far as a career path. The modern era of pharmacy education in the 1920s shifted towards formalized 3 and 4 year degrees, moving away from short courses and apprenticeships that had been the typical education before that. The first major study of pharmacy, practiced in 1927, led to development of a new curriculum focused on functional needs of retail pharmacists, emphasizing the basic sciences, medicine-related sciences, and practice-related subjects, but excluded diagnosis and treatment of disease to prevent counterprescribing. The educational landscape further evolved with the founding of ACPE, Accreditation Council for Pharmaceutical Education, in 1932, which established national standards for a pharmacy degree program and led to the widespread adoption of a 4-year degree by 1941. The 1946 Pharmaceutical Survey highlighted that there's a tension between pharmacist roles as distributors of these mass markets products and as healthcare professionals, recommending that a 6-year Doctor of Pharmacy degree be included to enhance professional preparation, despite the opposition from pharmacy educators. By 1950 to 1970s, the role of the pharmacist expanded from dispensing to providing patient care services, reflecting a cultural shift within community pharmacy practice, and leading to the establishment of the Doctor of Pharmacy program, or the PharmD programs, and that those focus particularly on emphasizing clinical education. The 1980s marked the beginning of the pharmaceutical care era, where there was a significant shift towards recognizing pharmacists as essential healthcare providers, leading to the universal adoption of the PharmD as the entry-level degree by 2005. The development of community pharmacy residency programs in the mid-1980s aimed to train pharmacists in providing clinical services, laying the groundwork for expanded patient care services in community pharmacies. The 1990s saw pharmacists becoming increasingly involved in patient care services, including immunizations with the Medicare Prescription Drug Improvement and Modernization Act of 2003, recognizing pharmacists' roles in medication therapy management, or MTM. And despite progress, the 2000s revealed that the majority of community pharmacists' time was still spent on dispensing, with patient care services growing slowly and the promise of MTM and Part D not fully recognized. That leaves us with today, the post-pharmaceutical care era from 2010 till now. This era has seen a continued increase in non-dispensing services like immunizations and patient care, with emerging opportunities for community pharmacies as partners in improving medication-related measures and decreasing total cost of care, despite challenges in expanding billing opportunities for pharmacists. Pharmacy school itself takes 4 years. There are 3 years of didactics in classroom plus labs, and 1 year rotation and one rotation in the summers between those school years. And then after that, there's 1 full year of clinical rotations. Most students apply to pharmacy school after earning their bachelor's, but there's no requirement for a degree to be accepted into the program as long as you have the prerequisite classes. For students that know they want to go into pharmacy school when they start undergrad, such as myself, it's very common to do all the prerequisite classes in 2 years and then be accepted in the program. So overall, students take 6 to 8 years to become pharmacists. And after that, if the PharmDs want to work with patients, they're required to take a national licensing exam, the North American Pharmacist Licensure Examination, or NAPLEX, and a state-specific law test, the Multi-State Pharmacy Jurisprudence Examination, or MPJE. If they want to be licensed in multiple states, the NAPLEX is just needed once to qualify for all the states, but the MPJE has to be passed for each state because the laws in each state are different. Pharmacy spots used to be very competitive to be accepted, but then more schools started opening and current schools opened more spots to meet demand of students that wanted to become pharmacists. In 1987, there were 72 accredited schools. Now there are 141. In recent years, the acceptance rate percentage in pharmacy schools has been in the mid to high 80s, as those openings are still available. But applications are decreased, and most of the schools have a preference for GPA, PCAT score, and a good references, but most also don't have hard requirements for being accepted in the program, so they can kind of flex those as needed. There are currently an estimated 334,000 pharmacist jobs. Outlook projects pharmacist positions to increase about 3% in the next 10 years, which is average. The community or retail positions are about 54% of jobs, and that's expected to remain flat. The hospital, clinical, and home health positions make up 33% of jobs, and those are expected to increase by over 10% each year as more pharmacists move into the clinical space to utilize the clinical knowledge they've been taught for decades now. And other is those unusual positions, non-traditional pharmacy, such as pharma or consulting. The ambulatory care pharmacist is a newer addition to the pharmacy specialties where the primary focus is treating chronic diseases. The pharmacist plays a role of chronic disease therapeutic management, choosing therapeutic options, and following up with the patient. Pharmacists typically are on site in primary care clinics. However, the ambulatory care pharmacist can also be found in the community setting, a community pharmacy. These are often examples of pharmacists practicing at the top of their license, utilizing much of their clinical knowledge in a primary care setting with decent autonomy. They are also required to be particularly strong to be able to carry the trash bag full of pills to their patients. Becoming an ambulatory care pharmacist does not have specific requirements. However, residency requirements are becoming more and more common in job descriptions. At least 1 year of postgraduate training is typically recommended. Additional certifications such as the Board of Pharmacy Specialties, BPS, or Board Certified Pharmacotherapy Specialist, BCPS, can also be helpful for hiring managers to judge the clinical competency of their potential hires. A pharmacist can transition into ambulatory care setting without a residency, but it often requires more years of experience and knowing the right people, just like most jobs. The continuing increase in our country's population life expectancy, the growing geriatric population in the United States, plus the exponential increase in new medication therapies, all lead to the need of more clinical pharmacists, such as ambulatory care pharmacists. Additionally, as roles such as MTM or for chronic conditions are expanding, so will the demand for specialized clinical pharmacists increase during the next decade. This session covered the history of pharmacist education, the requirements and competitiveness of pharmacy school, the general job outlook and breakdown and where pharmacists work, and finally, the role of the ambulatory care pharmacist.